good for the liver and I didn't know it. I was just thinking coffee, tea, green tea, all these are antioxidants. So they are extremely good. When I can say hepatitis A virus, hepatitis B virus, COVID virus will also attack the liver and cause damage to it. And that is where you've got this multi-organ failure and people have not been able to sustain.
Hi guys, this is Minidivan and you're watching TheHealthSite.com. Today we have with us Dr. Anita Suryanarayan, MD Path, Vice President and Quality Assurance, South SBO, Metropolis Healthcare Limited. Hi Dr. Anita, how are you?
I'm good. How are you doing?
Doing great. I hope things are keeping well at your end as well.
Yeah, and it's a pleasure to be here. So to have a chat with you on, liver disorders. So
yeah,
thank you for inviting us.
Yeah. So to begin with, doctor, liver health is really important. In fact, much more important than we realize at times. Though it's still, comparatively less talked upon. So today, let's clear out all the facts and, if there are any myths, let's burst them for all our viewers. And to begin with, let's understand why a healthy liver or why functioning of a healthy liver is so important, and what in retrospect, what are the consequences if it's not healthy? Let's begin with that.
Right. So liver is an organ. It's an organ like the heart and other parts of the body which are there, and this is an organ which has basically got two functions. So one function is when it is producing something. So it's also a producer of things, and it's a manufacturer basically, if you look at it that way. The other part, it is doing a garbage disposal. It's also a disposal. So if your liver is not good, you would run into issues with the production of certain things like prothrombin and vitamin K metabolizes and things like that. And if its breakdown is not good and it's not functioning, all the toxic elements will accumulate in the body. And when the toxic elements start accumulating in the body, then it will affect all the organs and it can lead to a multi-organ failure which can be there. And that is why people don't understand. They say a liver is only alcohol dependent. Actually, that's not so. If your liver is healthy, you could be sure that everything else is also going to work fine. It's a real master organ.
That's true, doctor. But having said that, since you just mentioned, it's not just because of alcohol. I think it's a very common myth that, if you increase the intake of your alcohol, that's the perhaps only or most common reason of liver damage. But I'm sure it's not just that. So let's understand what are the various causes of liver damage.
So one of the causes of liver damage, of course, is a large ingestion of alcohol and toxic substances which could be there. If you're into person is taking a lot of drugs, person is taking a lot of other substances which could be harmful without realizing it, that could be one thing. The other thing is it is prone to a lot of infection also, because it is one organ which is like it's like a mid person between it. So a lot of these hepatitis which we get, hepatitis is basically when your liver gets inflamed. And so the hepatitis which is there's the A hepatitis which comes in through your water and contaminated water. There's a B hepatitis which comes in through your syringes and needles. It could be a transfusion thing. There's a C hepatitis. There's a non-A, non-B hepatitis, and all these things together could affect the liver disease also. Also, if the nutrition is not good, we do start getting something what we call as fatty liver. For example, if a person is a diabetic person and is really not bothering about his sugar at all, then he will be prone to having a diabetic liver, what we call as a fatty liver, because the glucose will start getting deposited in the liver. The liver is not able to get rid of it so fast because the levels are very high, and so it will start accumulating in the hepatic cells, and so you start getting fatty liver, which is the initial stage. So if you correct it there, then one could probably save it up, and one would have no other issues with it and can be rectified. So good food, good eating habits, good exercise. They say things like coffee. Coffee is very good for the liver, and I didn't know it. I was just thinking coffee, tea, green tea.
COVID also impacted, the damage in any way, or perhaps induced the damage in any way.
Yeah, it will. COVID will. COVID has attacked every organ. COVID basically is a viral disease which goes for the mucous membrane. But one must realize that everything is lined by the mucous membrane. It could be in the first stage when we line the eyes, like the eyes are also lined by, a mucus which is there. Nose is also right, throat is also there. So that's why it's affected all these areas also. And the byproducts, because it has affected the metabolism and things like that, those also would have affected. It's a toxin, it's a virus. So when I can say hepatitis A virus, hepatitis B virus, COVID virus would also attack the liver and cause damage to it. And that is where you've got this multi-organ failure that people have not been able to sustain.
Also, doctor, to sphere back to how coffee perhaps is great for liver, which we didn't know. Similarly, now let's understand what are the healthy foods that can be great for your liver or to maintain your liver health.
So as I said, I also did not know that coffee is great. Tea is great, black tea without milk. Green tea is great. Any antioxidants. If you look at blueberry juice and you look at fruit juices, they're absolutely very good for the liver because they're all antioxidants. So add a good healthy diet, what we would call a good healthy diet, in a lot of leafy vegetables and fruits. Those are the things which are extremely good for the liver because it's very easy to break it down. So it doesn't cause any stress on the liver cells. Whereas if you take in the ingestion of a lot of, meats and things like that, while it may be good, but they're high proteins, they take time for it to get broken down. And so the toxic accumulation can occur. Nuts, all these antioxidants are extremely easy and they're very good for the good healthy food for the liver as such.
But apart from diet, is there any other way or perhaps any other thing that one should keep in mind to keep their liver healthy?
Yeah, of course, because apart from the diet, you do need to have your exercise. You do need to have your walking. See, now today, everything is boiling down to exercise and good, healthy. If you look at cardiac, we say the same thing. If you look at diabetes, we say the same thing. So if you look at liver also, again, we are saying the same thing, a good, healthy diet. And always remember that things like diabetes and all, this can also affect your liver. Anything which is going to affect the kidney will also affect your liver because it's accumulation of the toxic substance in your body. And so it will go to the liver where it will not be able to break it down. So a good healthy diet, moderate amount, a good amount of walking, eating, doing moderate, seeing that belly fat. Now they say the belly fat, I've also got it, but anyway, the belly fat which is there, that can be quite harmful for even diabetics and other patients, So things like that are also, so you need to have a fit body which could take care of everything else.
All right, doctor, I think this has been very, very insightful. Thank you so much for joining us today.
No, thank you so much. It's been so easy to talk to you.
Same
so
here.
It's been
Thanks
a true pleasure and I've really enjoyed talking to you. And anytime, please feel free to contact if you need anything. I'm always
Definitely.
Thanks a ton.
Pleasure, ma'am. Thanks a lot. Bye-bye.